in general, if you were faced with a new patient who was starting from scratch, could you give them any advice or tips based on your experience?
I'd suggest a great many things, yes I could. I would certainly suggest going to visit Coping with Cancer. The choice of activities and help there is amazing, really. And to even go and just sit there, if you're feeling unhappy one day, you can go and sit there and be so comfortable. It's a good atmosphere, and they'll make a cup of coffee for you, and you just feel lifted, which is amazing that just being there can do that. But there's plenty going on there, and that can lead on to all sorts of other things. Well, I have had a lot of alternative therapies. I've had many sessions of Reiki to help my jaw, because I was in a tremendous amount of pain with that, and nothing would alleviate it. So the Reiki was amazing.
Can you describe Reiki for the viewers?
Well, the Reiki seems to send you into a different sphere somehow, and it's the Reiki master or whoever is doing the treatment will gather energy and put that into the damaged part, or all over the body if needs be. And there's a difficult thing for people to grasp, really, this idea of getting the energy from the universe. And anyone that goes into it has to go into it with a clear mind, an open mind, and ready to accept, because accepting the treatment is a great part of it, not expecting it to be given to you. You have to accept it and invite it in.
So what other complementary alternative treatments would you recommend apart from Reiki?
Oh, well, I've had Indian head massage, that's quite a good one. And I've been to various relaxation sessions, and one meditation that I go to at Shepshed, he's an expert, and I go there on Mondays or Thursdays, depending when it's running. And it really takes you away from your body almost. It's so powerful, and it gets things in perspective.
All told, what do you think the role of complementary treatments is alongside your medical treatment?
I think, yes, I would say you definitely need to have both. If you're able to accept the complementary therapies, they are really worth having running along with the others, and then they can keep running when anything else is finished, apart from painkillers maybe. But they can run along with the painkillers and be more use even.
Is there an issue accessing them because they're not always freely available?
Some things can be accessed without paying, if you're extremely fortunate, and that will be for a short space of time anyway. Mostly you will have to pay. Occasionally I've been used as a demonstration model for these therapies, and then I get that one free. But I pay for Reiki when I have it anyway now, which is not the cheapest thing. If you have acupuncture, there's quite a few surgeries now performing that. I sometimes wonder if I could have acupuncture to stop the pain on my tongue, but who knows. And the meditation group I go to is £2 a session, so it doesn't quite break the bank. And occasionally there's free sessions there, because he's not profit making in any way.
So overall, it sounds like you definitely advocate complementary and alternative treatments.
Yes, I do, because I think they carry on from the medical treatments that are given, kind of have a limit, but the meditation and Reiki can go on forever.
Are there any other recommendations you'd make? Anything else you've come across that you'd say to patients, this is definitely worth looking out for?
I certainly think if any friend says to you, oh, I've got an ulcer in my mouth, or I've got something in my mouth that it's not, was that like yours, or it's not going away, I would certainly say get it checked. It was the dentist that found mine, and they are very good at looking at these things and recognising what's okay and what's not. And they can refer direct, or the GP can refer directly to the consultant or the department. And it is, for friends I've mentioned, sort of go and get it sorted, or looked at, I should say, because it's probably nothing. But 3 of those came back and they were clear, one wasn't, but it's dealt with without causing a lot of post-operative difficulties.
So one of your recommendations is for the public to watch out for these kind of symptoms.
Yes,
and go and seek
yes.
help.
Oh, certainly, yes. It's better to go and find it's nothing than to leave it and leave it and leave it and then find it's a big operation.
Okay. That's good advice, yeah.
Mm-hmm.